Hello there, welcome to Hurst. We are going to do a question together today. We have an NCLEX style question and I want to go over it with you with the correct answers and rationales. Now, first I want to talk about that test just for a minute. First, my name is Robin and I have been a Hurst instructor for the past 9 years. I have been a nurse for 29 years and I love working with nursing students. So I'm super excited to get to talk to y'all today. Now, let me ask you a question. If you do not pass the NCLEX the first time, what happens? Well, you have to take it again if you want to be a nurse, right? That's right. You have to take it again. But also, look right here. If you do not pass the first time, your odds of passing decrease. Now, the NCSBN, they tell us that your odds decrease to around 45 to 50%. I don't know about you, but I never want to be put in that category. So our focus is for you to pass the very first time. What is the purpose of this test? You've finished nursing school, you've done everything your instructors have asked you to do, but you still have that dreaded NCLEX. Hey, it is a safety test. It is designed to protect the public from unsafe nurses. Listen, before they just hand you a license, you got to show them that you can keep yourself safe, you can keep your coworkers safe. They're important too, right? And you can keep your clients safe before they just give you a license. And this test is unlike those nursing school tests, but guess what? Hurst Review can prepare you for that. We are going to do a question. Now, it is a select all that apply. My friend Thomas is going to put it on the screen and I'm going to give you a minute to chat your answers. Please chat your answers. What a great way to learn, even if you miss the answers, right? You will learn from that experience. Now, with your select all that apply, I want you to remember, you can have up to 10 options. There are no limit on how many could be correct. It could be one, hey, or it could be all of them. When you look at each option, you ask yourself, is that true or is that false? And then I want you to select your true options as the correct answers, okay? And don't forget, on the new Next Gen NCLEX, you receive partial credit, okay? All right, so chat your answers and I will be right back. Okay, let's read this question together. An unresponsive 13-year-old is brought into the emergency department. Based on your nursing assessment and current lab data, which interventions would be appropriate for you, the nurse, to initiate? Select all that apply. Now, we've already talked about select all that apply, but guess what? This is also called an exhibit, okay? You will have an exhibit tab that you can click on and it's going to open up and give you a lot more information about your patient, about your client. Hey, don't you want to get all the information you can about your client? Absolutely. So you make sure that you click on that exhibit and you read everything that they give you. Now, let me ask you something. You do not have to open those tabs, do you? Do you? No. Listen, it is not required. All you have to do is select your answer and move on to the next question. But why wouldn't you get all the information you can about your patient. Okay, so before we select, let's figure out what's going on in the stem of this question. When you look at the stem and the exhibit information, what do you see right there? You can see that this client is in DKA, right? Yes, this client is in DKA. Now, and they are also experiencing some Kussmaul respirations. So let's take our knowledge of DKA and let's answer this question. Okay, look at number 1. Administer KXLate. Do you think that's true or is that false? What do you think? That one is false. Hey, what is KXLate used for? We used it to decrease the potassium, right? Well, is the client's potassium high? Well, it's on the high normal, right? But wouldn't your client that is experiencing DKA, aren't they going to be receiving insulin? Aren't they? So you got to think about what you're fixing to do with your client. Yes, and what does insulin cause to happen to the glucose and the potassium? Well, it's going to drive them out of the vascular space and over into the cells, right? So by giving insulin, you can cause the client's serum potassium to get critically low. You don't want to give a medication that is going to make it low as well. So right here, this one will be false. Look at number 2. Initiate an IV of normal saline, 1,000 milliliters with regular insulin, 100 units at 10 mils an hour. Okay, true or false? This one is true. I hope you picked true there. Do you see in the stem where the client is experiencing polyuria? Yes. At Hurst, we teach you polyuria equals shock. Yes, I want to give that normal saline because that's an isotonic solution. That means it's going to go into that vascular space and it's going to stay there, right? And it's going to rehydrate the client and bring their blood pressure back up. Now, do you see those vital signs? Looks like shock to me. Also, does this client need insulin? Yes, absolutely. The glucose is high, so this client needs some insulin. Okay, look at number 3. Are we going to start oxygen at 2 liters per nasal cannula? True or false? False. Why? Well, the client's O2 is 96%, right? When do we start worrying about oxygenation? When it gets less than 90%, right? So that one is false. We don't want to hyperoxygenate them right here. Look at number 4. Start a second IV for fluid resuscitation. What do you think? True. Hey, clients in DKA, we're going to give them 2 IVs, right? And we're going to run that normal saline as fast as that client can stand it. The client is dehydrated. Hey, we need to replenish them right here, don't we? Absolutely. We need to do that quickly to keep them from going into shock. Look at number 5. Insert an indwelling urinary catheter. Is that true or is that false? What do you think on that one? That one is true. Well, let's talk about it. Don't you think you need a way to measure the client's urinary output? We need a way, don't we? A urinary catheter will allow us to do this. With the fluid problem, y'all, INO is always an appropriate action. Okay, so your correct options for this question are, let's put all of our correct options up. They are number 2, number 4, and number 5. I was waiting to see if any of y'all chatted any. Yes, good job. Number 2, number 4, and number 5. Now let me ask you a question. If you did not know your content like a brand new nurse should, could you answer this question? No. Listen, you have to know your core content first, and then you can apply that knowledge to many different situations, many different questions. And so since I said you've got to think like a brand new nurse, this is what we mean. We want you to think NCLEX. That's right. You have got to think NCLEX. You have got to assume the worst. You have got to pretend like something bad is happening in every test question. Hey, there's that safety again. Yes, safety. Y'all, there is going to be a safety there's going to be a safety issue in every one of these test questions, and you'll need to be able to identify that, all right? All right, the next slide I want to show you is Hurst Free NCLEX events. Mini reviews. You get to interact with a live Hurst instructor. You get to experience a snapshot of what a Hurst review would look like. NCLEX Challenge, it's where we go over those high-level NCLEX style questions. And NCLEX 101, that core information that every nursing student needs to know before they go take the NCLEX. All right. Now, I have you a discount. Free 2025 gets you $40 off of InStream. It gets you $25 off of Hurst Now Plus, and the Acid Base Essentials. Check out HurstReview.com. Look at all the products that we have there. There's our home office phone number, and make sure you're following us on all social media outlets. My friend Ashley and Sarah, they love to give away free stuff, and they will keep you up to date on the Hurst world and the NCLEX world. All right, thanks for joining. We hope to see you again real soon. Bye for now.